we're going to come back to your first book. I know, again, a lot has changed even in a couple years, but you talk about the transient effect of probiotic supplements in that book. So I'm curious, has research changed in that realm? Or are we still under the impression that those do have some benefits, but we need to continue to take those? And if we stop, the benefits basically stop.
I think the issue that I take with probiotics is not so much with probiotics. It's more so with the way that we're talking about the probiotics. I feel like we're not properly describing what they are and what their role is. And one of the challenges that exists with that is the hype trains that kind of get like they leave the station and there's all this hype and everyone's excited. But like, is that the way it actually works? Or is that just a bunch of people on the internet getting really excited about something? And so with probiotics, first of all, to describe them as worthless would be completely absurd. We have randomized placebo-controlled trials that demonstrate that they do in fact work. And speaking as a gastroenterologist, I've seen hundreds of patients, at least hundreds of patients, probably over 1,000, who come in and they say, look, this probiotic is great and it helped me a ton, right? Whether or not it's life-changing is a totally different question. Does it help you? That's meaningful as long as you can stomach the price. The challenge that we have with probiotics, which has not changed, is if you don't mind, Jesse, I'm going to use you as an example. Okay. So let's pretend that you're suffering with digestive health issues and you say to me, Dr. B, I think I'd like to try a probiotic. Which one do I try? Well, the way that I would approach it as a gastroenterologist is I would say, okay, so what symptom are we trying to fix? And if the answer is, for example, bloating, then I would go to the medical literature and I would search for a probiotic that's demonstrated value in that specific sense. But there's a problem in this sort of journey that we're taking together, and me being your doctor, is that you personally have a unique gut microbiome. There is no one on the planet that is exactly like you. I don't think you have an identical twin, as far as I can recall, but if you had an identical twin, you would only share 35% of the same microbes. You'd be 65% different. And so with that unique element to your microbiome, we can take this probiotic that a randomized controlled trial says it works. Cool. But what happens when we drop that probiotic into your unique microbiome? Do they get along? Is it helpful? Is it a complete waste of time? Serious consequences to probiotics are rare. It's not very common to have a serious problem. It can happen for some, though. So the point is this. There's a trial and error element to probiotics. If you decide that you're going to try one, you should buy a 1-month supply. You should see how you feel. And if you get better, then to me, there's value there. But if you take the probiotic, no matter how much the science says it's great, or no matter how much the marketing and the internet says it's great, if it doesn't help you accomplish your goal, it's just not a fit for you. And then you got to move on and perhaps try something different. And I think the last thing I would say about probiotics is, this is not just a probiotic thing. This is a more broad conversation. You know, the health of your microbiome is made up of some really big and massive parts of your life. What you eat, how much sleep you get, how much you move your body, how much stress you have, right? So inserting supplements into that equation, supplements are like a drop in a bucket compared to these bigger things. You can't out-supplement a bad diet, lack of sleep, inadequate exercise, and a ton of stress. It's not possible. But supplements can definitely help when you're getting these other things into alignment as well.
I hear you. I agree. And for somebody who is going to take one for a test run, like you mentioned, for a month, now there's so many different variables when it comes to probiotics. I think we're still in the early days in the evolution of them. But I mean, there's so many different things such as CFUs, how many billion CFUs, different array of different microbiomes that you can look at and pick out on the different bottles if you're in the refrigerated section. Then we have soil-based ones. We have spore-based ones. You being the gut expert, if you had to, recommend for a family member to do that 30-day trial, what route would you go?
I come back to the science. So, there's these different choices. But what have we actually shown through our research? Let the research be the compass that guides our choice, because there has to be truth. There has to be some sort of truth out there. I mean, I realize if it's a very confusing time, you hear a lot of different things out there, but truth does exist. And to me, the source of truth needs to be science. It needs to be clinical research. So I turn there. What are the probiotics that have been demonstrated to actually have an effect in terms of what we're trying to accomplish? If it's irritable bowel syndrome, is it irritable bowel syndrome with constipation, with diarrhea? There's different probiotics based upon those different things. So as a quick example, there's a probiotic called Saccharomyces, and there's different types of Saccharomyces. And one of them is good for diarrhea, and the other one is good for constipation. And so that's where having that awareness to take a look and try to identify what specific probiotic is good for what specific medical indication, that's to me where I want to start, as opposed to just like what is sort of the hyped up thing. I try to be more specific about it using the science.
Got it. But you do talk about in the first book, you prefer the ones that don't require being in the fridge, figuring they have a better chance of making it to where they need to be.
Yeah, I like that. I like it when they have a delayed release capsule. That helps to get it past the stomach acid. We were talking about that before. Most of the time, higher numbers of CFUs will do better. So like, what's a high number of CFUs? So 50 billion is a high number. 10 billion is decent. 1 billion is pretty low. Usually a more diverse probiotic, meaning multiple different strains, typically does better, but that's not universally true. So again, there are these sort of general rules that I apply. Delayed release capsule, not refrigerated, comes in a blister pack, higher number of CFUs, wider variety of different microbes. Those are general rules. But if you show me a study where they did a placebo-controlled trial and they showed that something works, that is the golden rule.
But at this point, have they done any studies like they've done with fermented foods where they can see even 5-10 weeks that some of these have seeded themselves and they're still in the digestive tract, or has that still not happened?
So the observation that we've made so far in terms of probiotic trials is that for most people, it seems that they do not seed. And I think what it speaks to is the complexity of what we already have inside of us. It's already very well established. So it's not necessarily looking or welcoming the opportunity for new microbes to come in and take up residence. So that it does speak to that complexity. I have not seen a study like the Sonnenberg study with fermented foods that have shown a sustained increase in diversity in the microbiome. And bear in mind also, Jesse, when we talk about fermented foods, we're talking about a diverse ecosystem. Going back to the apple, which is not fermented, but that apple, I said 100 million microbes. Well, it's also got hundreds of different species. And so in each of these cases, we're talking about a lot of different species, diverse ecosystem versus the probiotic, which is typically like anywhere from 1 to perhaps 10 specific strains in a very high concentration.
So now this is where I want to go next, the diversity of the food versus the probiotic, because that is a nifty thing about the probiotics. You can see how much there actually is or supposedly is, and all the different strains versus making your own sauerkraut or buying a non-pasteurized sauerkraut at the store. And then it's kind of a guessing game what you're actually getting.
Right.
But what you're saying is with the foods, you can expect to have a bigger range and they're a lot more potent. Do I have that right?
They have a bigger range for sure. So by range, meaning diversity, more varieties of species. In terms of the individual representation of those species, and like, do we have the high CFU counts? CFU, by the way, for those who are wondering, it's the colony forming unit. It basically is a measure of like, how many microbes are we really talking about here? So based on what I've observed, I would describe fermented foods as being on an individual species level, lower CFUs, but more variety. And the probiotic is more of like a super high CFU, but less variety, more focused. So that to me is where the discrepancy exists. Now, how do I approach this issue though? I think that's the important thing here. What I would recommend is, I don't care who you are and whether you have gut health issues, or maybe you don't have gut health issues, you still should be adding fermented food to your diet. And the argument that I would make is that, like, for example, the person who has no gut health issues, the argument that I would make is, earlier in the episode, I mentioned that this part of your body, your gut microbiome, is connected to your digestion, metabolism, immune system, hormones, mood, brain health, energy levels. You should not take that for granted. This is the last part of your body that you should be neglecting and just taking the expectation that everything is going to work out okay. No matter who you are, because this is so important, you should have a plan. And that plan doesn't need to be something that sucks and like drains you of zest for life, right? The plan should be quite simply incorporating a healthy diet and healthy lifestyle habits that bring you great energy, make you feel wonderful. You love the food that you eat, but allow it to be food that simultaneously is lifting up your gut and nourishing it and giving it what it needs, right? So my argument would be, Jesse, everyone should be eating a wider variety of plants. Everyone should be adding fermented food to their diet. Don't wait until the bomb goes off. Don't wait until you have a problem. Do it today. But for the probiotic, when it comes to the probiotic, so like, to me, you've already layered in the fermented food. And then you're asking the question, do I need a probiotic? Well, what are the specific issues that you're trying to address? And let's identify the probiotic that's the best fit for those specific issues. Because we do have the advantage, by the way, with probiotics, where we have studied them within that context. So it's not just a general like, hey, are they good for your health? It's more like, hey, are they good for a person who's got irritable bowel syndrome with constipation? Are they good for bloating? Are they good for abdominal pain? Right? So we've studied them in that specific context. And that's one of the advantages that we have with probiotics, is there's more research there.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
I call this the golden rule because no matter who you are, no matter what dietary pattern you follow, this is something that you can apply. And I think it's very tangible, very easy to follow, and can be potentially game-changing for a lot.